You're watching KARK4 News at 4.
As the Delta variant continues to surge in Arkansas, many of you have questions surrounding COVID and the vaccine. Dr. Wendell Pauls has joined us throughout the week live to answer your questions. He joins us again today. Dr. Pauls, thank you so much for joining us. We appreciate your time this week, and we want to begin with a question coming in from Pam. Pam asks, if a new mother gets the vaccine after she has delivered her baby, will the baby still get antibodies through breast milk?
Absolutely. Breast milk is pure gold for a newborn infant, and if a mother is vaccinated and generates an antibody response, some of those antibodies cross into the breast milk and will help protect the baby. So for a breastfeeding mother, we would strongly encourage her to get vaccinated. It helps her and does indeed help protect the baby.
That is good news to hear. Let's talk about the flu shot. This time every year, we are always hearing about the flu shot and doctors encouraging people to get the flu shot. Do we still need a flu shot this year? And if so, when do you recommend getting one?
Shots, and more shots. We're all about getting shots. Yes, ma'am. Even though we are strongly encouraging everybody to get the COVID vaccine, you still want to get your flu shot. We still, unfortunately, have people get very sick just from influenza. So even if you get your COVID vaccine, we would still strongly encourage you to get the flu shot as well. And as far as when, pretty much as soon as it's offered by your either physician or clinic or pharmacy or wherever you get your shots every year. When they're offered, I would go ahead and get them. Some people ask, can you get them together? And if they're both offered at the same time, it's perfectly okay to get a COVID vaccine and a flu shot all at the same time. That's fine.
Let's just knock it out all at the same time. Good advice. Thank you, doctor. This question coming in from Jasmine. Jasmine asks, have we learned anything new lately about the long-term effects of COVID?
Well, we have. There was a recent article in Lancet that looked at long-term COVID, and we are starting to see a pretty fair number of people that are having some long-term effects: weakness, fatigue, muscle aches, other long-term effects, and long-term lung troubles. At first, it looked like it was around 12 to 15%. The Lancet article seems to indicate it may even be higher than that. So we don't know how long-term those long-term effects in COVID are, because COVID just hasn't been around long enough to have any real big retrospective data on it. But there are some long-term troubles associated with COVID. So if you don't want the long-term troubles with COVID, try not to get COVID. And the best way not to do that is to get your shot.
Good advice there. Okay, this question now coming in from Chris. Chris asks, are the symptoms of the Delta variant different than other COVID symptoms?
Well, yes, they are a little bit. You know, the Delta variant is still a variant of COVID, so you still have a fair number of people that will have shortness of breath, fever, cough, congestion. They have the anosmia or loss of sensation of smell and taste. But the Delta variant seems to have more GI troubles as well. People have belly cramps, some vomiting, some diarrhea, just some kind of general stomach aches and pain as well. So even if you don't have the pulmonary complaints and just have GI troubles, that may very well be COVID.
Wonderful advice. Dr. Wendell Pauls, thank you so much. We appreciate you. I know you're very busy right now, so thank you for taking your time this week to answer many of our questions.
Always happy to help.
Thank you again.